talking about knee pain. Now obviously this is a massive subject and I don't hope to cover it all. What I want to talk about is perhaps the sort of pain that you've got if you've done a run that was a little bit longer than normal, or you got off the sofa slightly awkwardly and you've tweaked your knee, you've woken up in the morning, the knee's perhaps a little bit puffy, a little bit painful to weight bear on, and perhaps the movement is a little bit restricted, indicating that you can't fully bend the knee perhaps. And this is quite common, usually affecting people over the age of 30, and it tends to mean, not always obviously, but it tends to mean that the cartilage inside the knee is a little bit worn and you've irritated that. Now in years gone by, they used to do a lot of day case surgery with these, used to wash them out, sand them down, smooth them, trim the cartilage, etc. And they don't tend to do that anymore. Research has shown that actually exercise, physio and exercise and regular movements can help to almost sand down the cartilage inside the knee and mimic what that surgery has done, and will get it better on its own. It might take a little bit longer, but in the end you will maintain and keep all the cartilage that you don't want to get rid of. So my advice is to really, first of all, don't panic. Keep the knee moving. Movement is very useful. It's a pain reliever in itself. What we want to avoid is any movement that involves sort of twisting. The knee doesn't like to be twisted. So for example, when you're standing in the kitchen, you're going from one surface to another, be careful of that. Try and lift the feet to move. Don't rotate the knee. Reduce your impact. So obviously if you are a runner, don't go running for a couple of days. There are lots of other things we can do and we'll talk about that, but reduce the loading of the knee. That direct impact, the cartilage isn't going to like it. We do want to keep the knee moving, that's really important. If you've got access to an exercise bike or a normal pushback, that's absolutely ideal. We want that large amplitude of movement to almost, as I say, help to sand down that cartilage and smooth it down by itself. And you can start to do this from day one. If it's painful, it will settle down the more you work it, the more you exercise it. Obviously you can ice the knee regularly if it's a little bit puffy. You could wear a knee support to provide a little bit of compression. In the first stages, I wouldn't necessarily run to the anti-inflammatories. When you've got an inflammatory reaction in a joint, you want the body's own immune system to come and deal with that. So perhaps some paracetamol, particularly if it's painful at night, which they often are, but don't rush to the anti-inflammatories right away. As it goes on, yes, maybe take them after a couple of weeks. So my message is, basically we want to avoid particularly rotation movements. We want to avoid high impact, anything like low squats and things, which are obviously going to stress the knee. But we do want to keep the knee moving. And the ideal way to do that is on an exercise bike or push bike. A rowing machine normally involves too much flexion. That can give some pinching at the back of the knee and that can be uncomfortable. But keep it moving on the exercise bike and give it time. Now this can take anywhere from 3 to sort of 9 weeks or so to really let it settle. But usually they do settle on their own. If they don't settle and it's still uncomfortable after a couple of weeks or months, then obviously go and see a physio or an orthopaedic consultant and have some investigations done and see where to go from there. But usually they will settle on their own. And so years ago, they used to do surgery for these. Nowadays, it's very much exercise based. So don't panic, ice it, keep it moving, apply a little bit of compression. It doesn't necessarily need hands-on treatment, it just needs regular, gentle movement and it will settle. So take care of your knees, but we'll do another one talking about specific knee problems soon.